Hello, my name is Vanessa Perez, and today I will be talking to you about doxorubicin. I'll be talking to you about the mechanism of action of this cancer drug, some side effects that may come about by using doxorubicin, and a few facts about this drug's discovery. And at the end, I'll ask a question for you guys to ponder on. Alright, so let's get started. So the mechanism, Doxorubicin is an anthracycline anti-tumor antibiotic, and it's used to slow or stop cancer cells from growing by intercalating with the DNA helix between base pairs. This action prevents DNA from replicating, and this will ultimately inhibit protein synthesis. So it prevents DNA from replicating by inhibiting topoisomerase, as you can see here. This is the enzyme that is needed for DNA replication. Topoisomerase is needed in the cell cycle and functions by unwinding DNA supercoils to allow DNA to undergo replication. So as you can see here in this figure below, DNA synthesis replication occurs in the S phase of interphase. So it will block DNA replication by inhibiting topoisomerase from functioning properly. And it's also just suggested that doxorubicin will increase levels of p53, which you can see here. So whenever there is DNA damage or any cell cycle abnormalities, which would include the cell cycle cancer cell cycle, doxorubicin will increase levels of p53, causing it to undergo apoptosis. And this will result in the death and elimination of the cancer cells. Okay, so some side effects that may come about. Patients that have taken this drug may experience genotoxic effects after chemotherapy treatment with anti-topoisomerase agents. So one example includes developing a secondary leukemia, and this can occur when patients have been exposed to radiation. This involves the translocation of chromosome 9 and 11. So here I included a figure to show you exactly what translocation is. So a translocation occurs when a region of one chromosome is physically removed and joined to a highly active region of another chromosome. So here you can see that this portion of the chromosome A, or chromosome 9, is broken off and attached to this highly transcribed region of chromosome 11 that may contribute to the higher transcription rate of that region. Also, heart damage, heart failure, hair loss, loss of appetite, sore mouth or throat, and even blood clots can occur by using doxorubicin. So some drug discovery facts that I came across. So doxorubicin is an antibiotic, and it was first discovered from actinobacteria, the Streptomyces paucidius strain in the 1950s. It was found in an area surrounding Castel de Monte, which is a 13th century castle in Italy. And it was found to exhibit anti-tumor properties through clinical trials that began in the 1960s. It was approved for medical use in the U.S. in 1974, so we didn't actually start using it for medical purposes until then. So one question that I did want to ask is, what is the difference between doxorubicin and doxorubicin hydrochloride? Throughout this research, I kind of saw that both were kind of being used, but not sure if there was a proper distinction between both of them. So what do you guys think? And here are the references that I used in order to make this presentation possible. All right, thank you so much.